All right. Welcome, welcome, welcome. We are starting our new episode of All Things Odd. I'm trying to get this shared into a couple of different posts. We're super excited today because we are going to be talking about just how the auditory system development is in utero. And as we kind of get people in here, Dr. Galloway, I would like to first of all say, I'm going to have her make a little announcement because we're trying to figure out, if you're trying to figure out why are we talking about this particular topic, I'm going to pass it over to Dr. Galloway.
Yes. So I'm pregnant. Surprise.
Yay!
And I'm due in September. And actually, it's pretty funny because when we did this show from our previous office, we did a show like this and we talked about kind of embryology and some different things about pregnancy and hearing when I was 18 weeks pregnant. And I'm also 18 weeks pregnant this time. So it's funny that we had a research episode coming up because I'm like, oh, we can talk about the embryology research that we looked at before. So yes, very relevant.
Yes. And we're so excited. We're so glad. And she's doing very well, very healthy. And so if you just missed it and you're just joining, we are covering the auditory system and how it develops in utero because Dr. Galloway is pregnant again. So you'll never hear that from me, but we're doing it because Dr. Galloway is pregnant with her second child. And it's kind of fun to kind of review these facts again. And again, this is kind of in our research part of our show. So it's super relevant. So with that, we are going to kind of head into some facts first. We're going to go over some facts. We're going to talk about, she had some great information that she obtained from her physician in her first round. And so we're going to go over that as well with CMV and testing. And then just, again, if you're joining and you want to be part of the conversation, come be part of the conversation and put comments in the comment area. Or if you've got something else that you want to add to the show to help people learn about the auditory system, or even while during pregnancy, that would be great too. So, okay, so we're going to start off with the first fact, and I'll let Dr. Galloway talk about this one. Oh, not the battery one. Sorry.
I don't think we're talking about that. Yeah. So structurally, parts of the ear develop during the first 20 weeks of gestation. That's actually like right about where I am now. And then the neurosensory portion of the auditory system is kind of after 20 weeks. So in the second 20 weeks portion, which makes sense because the brain has to develop, that first 20 weeks before you're going to have, sort of brain connections made. So these studies that we're kind of looking at, there's been a lot of different studies, and some of them are actually seeing the baby respond, but some of them are, actually measuring. So they're done different ways. But that's our first sort of development fact.
Well, and it's interesting because talk to us a little bit more. It's been a long hot minute since I was pregnant. I think my youngest is 14. So talk to us a little bit more about the fact of like the ultrasound. When do you actually go in and get your ultrasound done? Like, I don't think you're 18 weeks, you said right now, 19 weeks.
They definitely do one at 20 weeks for everybody. Because that's when they do what they call the anatomy scan. So they go in and they, like with the ultrasounds that we have today, you can see so well. They actually measure like the nasal bone and all kinds of things to see like structurally, they'll measure all the different organs and the heart, and you can actually see the separate chambers of the heart on the ultrasound. It's incredible. And they're 3D now too, so they can go between like 2D and 3D mode. They can also check the blood supply of the placenta and like everything there. It's really incredible. So after that 20-week anatomy scan, you sort of know that growth is on track and, size-wise, everything looks good. So some people do, and I think if you're older, when you become pregnant, they do more regular ultrasounds just to kind of check. I had one at the very, very beginning, really early on, so you couldn't see much. And then I'll have another one in a couple weeks.
Wow. I remember, so back in the day, when ours were 2D, they were just getting into 3D. And I think I do have a 3D ultrasound of my son, who's now 17. But I was thinking as you were talking, like, yeah, back in the day, my ultrasound was like a picture. Your ultrasound is like here's where everything is, and they're waving hi at you, and
Yeah,
it's
and it's
like,
like a video link. Like it's like a 20-minute
wow,
ultrasound with like hotel music in the background. And we sent links of it to our parents so that they could,
oh my
watch the ultrasound, which is
gosh.
cool. But yeah, thinking back, like my mom didn't have any ultrasounds, and like they only even tried to do that if there was something wrong. So it's just
Right.
very different. We know so much more now before the baby's even born than previous generations ever did. So
So you're heading into your 20 weeks, which will be your ultrasound. And guys, what this says is it's the structural portions, yes, are developed in the first 20 weeks, but the neurosensory part is starts to develop after the 20 weeks. So it'll be interesting. I don't necessarily think you said that you could kind of possibly see the nasal bones. I'm not even too sure if you'd be able to see the ear, since
yeah,
the
I
structural
don't.
portions are.
And obviously that's not something on their list that they're
Sure.
checking. But I'm sure that there's, some detail there. I just don't know.
Wow, that's really cool. All right. So, our next fact is the auditory system becomes functional around 25 weeks of gestation. And this is
Yeah.
super interesting because now that you've got the structural portions and now that you've got the neurosensory portions starting after 20 weeks, right?
Mhm.
This is talking about that auditory system. So, if you think about it, if you're 25 weeks pregnant, right? Or gestation, I should say, like this is actually the time where the fetus would be able to hear you. So
Mhm.
whether it is speaking, to them, playing music on your belly,
Yeah.
whatever it is, this would be like the prime time is this 25 weeks, right?
Yep. Yeah, and I remember last time being pregnant, like towards the end, if there was like the dog would bark, like something that was really unexpected, you could actually feel the baby move, like towards the end of my pregnancy. But yeah, it happens earlier than we even know. And so one of the studies I was looking at, they're measuring like the heart rate and the movements of the
Mhm.
fetus, like in response to the mom's voice. And yeah, that's all after 25 weeks too.
So let's kind of talk about that research, and I think it was this one right here with Hepper. That
Yeah.
research right there. Okay, so
Yeah.
let's talk about that research because I think it's kind of interesting and it talks about since we've talked about the auditory system
Mhm.
now being, functional at 25 weeks. So talk to us about this research and I believe we have a link here too that I'm going to put in the comments so it's a clickable link to this research.
Yep. So they were able to see that the fetus would first respond to lower tones and then higher tones as far as pitch goes. So that's interesting because the cochlea is tonotopically organized. So
Mhm.
it's like, the first part of it developing is responsible for the low frequencies as the rest of it develops. So that's really cool that they were able to determine that. And that study is actually from 1994, which is impressive. And there's, been a lot of other studies since then that have kind of shown different things as well. But yes, that's really interesting. And the period that sort of follows that the 25 weeks to the 5 to 6 months of age, that's kind of like the most critical for the neurosensory portion.
Mhm.
Because like you said, structurally, we have the development of the inner ear parts, and then as that nerve connects to the brain and actually starts to send signals, um, yeah, that's when we really start to see things happen.
Yeah. And what's interesting about that research too, so I put the research article in the comments, so it's clickable. So people that are really interested in that research, you can click in the comments. There is that link to that Hepper article. Is that how they actually did it? Because people are,
Mhm.
as you think about this, like, how did they actually test the baby, right? And
Yeah.
I think that you had talked about it as well before in how they actually did it, right? So do you remember?
I don't. This one, because I just looked at several, but let me see. I've got it pulled up here.
So I think what they did was they took the speakers and presented that stimuli,
Hmm.
and then they waited for the behavioral responses because you're thinking like, how the heck are they going to test
Yeah.
the baby, right? And so what they did was they put speakers there and put the different frequencies in, and they actually waited for a bit, like how you said, like your dog barking, right?
Hmm.
They were waiting for like the response from the baby of either probably just movement, obviously, right? They're not going to obviously say raise their hand or whatever, but
Well, and
that's how they did it.
Towards the end of my pregnancy last time, they tell you to count the kicks and everything and like see, like how many times did you feel the baby move? And especially when you're pregnant for the first time, you can't really tell. So they did this thing where they put it essentially like an EMG recording like on this band across my pregnant belly. And then they gave me a button, like a response button, and told me to push the button whenever I felt the baby move. And then they compared the information. So I could see them doing that same thing, like, having a soundtrack and knowing at what time the auditory, stimuli occurred and then comparing it there. Because what they were showing was that she was moving a lot more than I was actually feeling. So it depends on, how much fluid there is and the placenta and all of that. So
Yeah, interesting. And to go back to this other fact here with this article, with those low tones is what's coming through, right? First. I think that's really kind of interesting too. And then to get the mom involved as well, because you're the one that's feeling it.
yeah.
But I know that we had thought about even like it depends, maybe the low tones were the ones that were coming through because of the fluid sac, right? And
Right.
that's what you were noticing that, maybe that's what the baby is actually
Like the
hearing or
bone
feeling or.
conduction. Yeah, the bone conduction response. That's what I would think, because that they are suspended in so much fluid that bone conducted response would be stronger, I would think.
Yep, absolutely. All right. Well, this fact here at 27 weeks gestation, 96% of fetuses responded to 250 and 500 hertz, which is kind of what we talked about earlier, right, with the early weeks of gestation, but none really to that 1,000 and 3,000 hertz until maybe about 33 to 35 weeks again.
Mhm.
So maybe again, could be a lot of different things. We already know the structure of the ear was complete or, was early on. But maybe, what I'm thinking, and again, this is just speculation, is maybe as the baby's growing and getting bigger, that sac is a lot less. And so those high frequencies are now getting through if it was,
Mhm.
just those low frequencies getting through before. And maybe some of the higher frequencies are now getting through as well. I don't know. I have no
Yeah.
idea. That's just my
Well, and
speculation.
thinking about that, so a lot of the studies are looking at response to maternal voice, and my voice would be traveling via bone conduction too, really strongly near the baby.
Hmm.
So I feel like my voice is probably an exception because it is in the higher frequency range, but it would get there a different way.
Hmm. Interesting. Yeah. Yeah. All right. Well, with that, we are also going to shift. So that's just, basically the process of the auditory system developing in utero. We thought it was kind of interesting, especially because we're doing it again because Dr. Galloway is expecting her second child. So we thought we'd talk about it again and kind of bring that up. But here's also something interesting. During her first pregnancy, she had a conversation. Well, I know that we went to a workshop, the Eddie workshop, right,
Yeah.
well, for Colorado, and you had learned some things, which then spawned some conversations with
Mhm.
your own physician and thoughts about
Yeah.
what you wanted to do. So let's talk about CMV first of all, which is the most common infectious cause of birth
Mhm.
defects in the U.S. 1 in 200 babies are born with congenital CMV. So, what are some of
So
your thoughts?
yeah, so when you first have your baby, they do this blood spot panel, and they do it on every baby that's born, and each state has different tests that they do at birth. And actually, Trista and I were on the show recently, and we talked about this in coordination with something else. But you can look up your state and see what tests are done at birth, and CMV is not done, and it's not commonly done across the United States, even though it's 1 in 200 babies that are born with a congenital CMV infection. And further, when I sort of asked about it, it was clear that nobody else had been asking about it. Like my provider had to look it up. And, the original information I was given while I was pregnant, it's like, yeah, we can test you.
Mhm.
But that even if I had a CMV infection with no symptoms and they tested and they found that out, we wouldn't know that the baby didn't have it. You know what I mean? And
Mhm.
so the only way to figure that out is to do a blood spot, either blood or urine within the first 7 days of life. So it's actually your pediatrician that you coordinate with, which what we found is it's hard to establish a pediatrician before your baby's born
Mhm.
because they're not born yet. They don't have a date of birth, so they can't put them in their system. So we actually just went with the physician, the pediatrician who was like on call at the hospital and just came through and did the rounds. And then we ended up working with her. But she ordered the CMV test. So it's just, I don't know why it's not more on the radar of everybody, but Dr. Phillips and I went to this EDDI conference, and there was a primary care doctor there and a nurse practitioner from Children's Hospital who's doing a lot of research on CMV. And the primary care physician's own daughter had an in utero CMV infection, but they didn't know until she was like 2 years old. And she was having some issues, like some structural development issues. I think she was working with an occupational therapist, and she had some visual issues. And, you know, once the child is 2, you can't go back and figure out if that's what they had, but they were like pulling pieces together. So it happens more often than you would think, and people are just pretty undereducated about the issue. For us, CMV infections in utero can lead to progressive hearing loss. So, you know, a baby might pass their newborn hearing screening and then literally reach deafness within the first 2 years. And unless the parents are picking up on that, you know, that could be easily missed. I could see hearing loss coming on gradually within 2 years. So it's, you know, gradually, but quickly progressing. That's tricky because if you take your baby to the pediatrician, they're going to say, did they pass their newborn hearing screening? Well, yes, they did, but there are some conditions that can be, you know, progressive deafness. So.
Well, and even the woman that talked at the EDDI conference or the workshop, she was a physician herself, right?
Yeah. And so
I think her daughter wasn't identified until 2 years of age with a hearing loss.
Well, and you're most at risk when you're like the mom of a toddler. So I would think that a pediatrician would be right there in that same boat because you're seeing toddlers, you know, throughout the day. Just because like my toddler she doesn't go to a daycare center, but she goes over to another family's house, and then they go out and about and go to, you know, MOPS and different outings and the park. And so there's just a lot of germs exchanged. And my daughter will like try to put her hands in my mouth and, you know, stuff like that, unprovoked. So I see how I could get a CMV infection from being around her.
So I know that you talked briefly about the test too, but this is just a fact about how they test for CMV, and it looks like it's within 2 to 3 weeks only of birth.
And that's what I saw when I did the research the first time before Ruby was born. But after Ruby was born, they told me it's best to do it within the first 7 days. And also you want to do it while the baby's in the hospital. So for Ruby, they actually just like attached a little like bag and collected urine that way. And, you know, so you wouldn't want to go home and try to get that urine collection because you're trying to get it before it absorbs into the diaper. So they have like some special methods of doing that with little tiny babies. And then that way they just sent it in for testing at the hospital, and it was, you know, all billed under the hospital stay and that kind of thing.
Yeah, that's really smart, actually. I'm actually surprised that it isn't a routine screening, you know?
Yeah. And Trista and I, when we looked up the state by state, there was like something called maple syrup urine disease, which was like some metabolic disorder that was super, super rare, but it was on the list. So I don't know how we get CMV on the list. But I know there's a physician's assistant at Children's Hospital, and I actually looked her up last time when we talked about this because I'd like to connect with her and see, you know, there's obviously got to be some momentum towards that, I would think, if we could get that changed.
Well, and it's interesting too because, you know, as with CMV being the most common infectious cause of birth defects, right? Which is 1 in 200. I think like hearing loss is like 2 to 3 out of 1,000, right? That babies that might have hearing loss, which is lower than CMV, and we screen for hearing loss at birth. So it's kind of crazy that it's not.
I just found that website that I talked about when I was on here with Trista, but it's called babiesfirsttest.org. And I can put that link in the comments so that we can share it. But you can select state, but select by state, and it'll tell you what conditions they're looking for. So the maple syrup urine disease was in Colorado. And so there's this huge list of everything they test for, but CMV is not on it. So
crazy. And I forgot we were going to do one other link, which is going to be the some information about CMV too. We wanted to get out there as well.
Yeah, it's CDC information about CMV, so it's updated regularly. That's just kind of their whole site. And then, Natalie, I'm sharing here the that website called babiesfirsttest.org, where it will tell you what is being done. And then you can order additionally, like if you read about some other test that you feel like is important, that's what we did, is just kind of add that on. So.
Okay, so I'm adding that link as well. So a lot of clickable links in our comments. So head to the comments both on YouTube and on Facebook. I'm not sure if these comments are going to go through to the LinkedIn as well, but you can always catch the replay on our Facebook page or on our YouTube page as well. So yeah, so it's kind of interesting. You know, I wanted to just walk through the protocol also for newborn hearing screening, since we kind of touched upon that as well. We believe that, you know, in the first, when the baby's first born, they do otoacoustic emissions, which is a very quick test. Granted that the ears are fairly clear of vernix, but we do a quick test to see if the inner ear is functioning, right? And that's done most of the times just even if the baby is in the mother's room, they can bring that equipment in. Sometimes if the baby was in the NICU, then we do an auditory brainstem response type of test. It's not a diagnostic test, it's still a screening test for that. If they don't pass, they try it one more time before the baby's discharged. That's still considered a screening. And if they don't pass, then they're referred to an audiologist that does diagnostic testing. And I know the last time we talked about it, we talked about diagnostic testing at an audiologist's office. Typically would include either an auditory brainstem response test or some kind of tone burst test, which takes a long time, or and bone conduction, ABR. Or there's a test called an auditory steady state response, or ASSR, and you are able to get 4 frequencies on both ears at the same time. So it's a lot easier to do. And it's super important because one of the facts that we did put up here, I'm going to try to get it back up here too, is that it's super important to try to get the child, now the baby or the infant, tested and identified before 6 months of age to get hearing aids on them before 6 months of age. I know that sounds crazy, but you can fit a child with hearing aids early. And the reason why we do that, it's not just about identifying them, but it's also getting amplification on, is because our own in Colorado researcher and audiologist, Christine Yoshinaga Itano, did a research where if you're able to identify kids before the age of 6 months and get amplification on their speech delay, they catch up really fast. So that speech delay doesn't happen in at least 80 to 90%, I believe, of kids. And so you're really taking that level down where the child later on will have to go through speech therapy to catch up. So that is our goal, is to get them identified and amplified before 6 months of age. Super, super, super important.
Well, and you know, what I was finding when we were testing newborns at the previous office that we were working at, and what I found was that the rate of, you know, newborns referred to us, it started to go up, that most of them were hearing impaired and did have hearing loss. And so, you know, when we first started accepting those referrals, we would get quite a few that were, you know, just had normal hearing, you know, but it was just not, you know, identified at that time. But towards the end of our time there, I was noticing more babies referred, but all of them did in fact have some pretty serious hearing loss. So I think the screening capabilities are getting better. And when Trista and I were talking about this before, we both had ABR, both of our babies had ABRs in the room.
Nice.
And we both, you know, had babies locally. So I don't know if Colorado just automatically does ABR testing instead of OAE testing. That's probably varied by state. But I at least know that the kind of screening program that they're using here at the local hospitals does ABR first off. So maybe it's just more effective.
Yeah. Well, hopefully this got you interested if you are pregnant, or think about down the line, you know, when you're in that hospital, or if you have even family members that you have them aware of, especially the CMV testing, I believe is super important. And then just kind of being aware of the newborn hearing screening program that's done in the hospital. But if anything, you have any questions of maybe my child is not responding, or you're noticing some different things, please reach out to an audiologist and have them do the testing. Because as you can see, we can test as early as newborn, like within the day, right?
And actually, the first 6 months is kind of the easiest to test them because they're sleepy and they're not coordinated enough to rip stuff out of their ears. Well, sometimes they surprise you, but they're just a little bit more relaxed. And so that way you can get the response without, too much going on. They're sleeping a lot. So
yeah. And it does sound silly. Like if you're noticing that your child's not responding, it's not like before 6 months of age, they're going to be like, I don't hear you, mom, or
yeah.
whatever, right? They're not going to tell you, and sometimes even that reflex of that turn and look when they hear something might not necessarily happen until later, right?
Yeah.
But even if you don't get it within 6 months of age and you're like, oh, don't feel like you're a terrible parent. Just when you start to notice it, or if you have a family history as well, get cued into that. But just know that audiologists can definitely help, and we want to spread that awareness.
Yep.
All right. So with that, we're going to close off our episode of All Things On, and we will be back next week with a whole new episode. And we'll see you then at 12:30 p.m. Mountain Standard Time.